New Hampshire has one of the highest numbers of opioid and drug-related deaths in the country, and that's made it a key focus on the campaign trail here. CBS News Chief Washington correspondent Major Garrett spoke to one family feeling the effects over multiple generations.
Paula Wilson is 64 years old and a recovering opioid addict who has also struggled with alcoholism. She's the cleanest family member to raise 16-year-old Devin, her grandson.
He's a high-risk kid because of a number of factors. You know, his early childhood experiences, the family history.
Devin, at times reluctantly, has lived with Paula for 8 years.
I don't really think of my past at all, so I kind of just ignore it.
The toll on the Wilson family, almost unimaginable.
Both my husbands were heroin addicts. 3 of my children have been multi-drug use, but primarily opioids have been their drug of choice.
That's a lot for one family.
It is a lot. It's a large family, and the cycle of addiction is strong.
And repetitive.
So we're en route to a report of a 55-year-old female who's overdosed.
Manchester, New Hampshire District Fire Chief Mike Gamache.
We see some of the same people all the time.
Last week in Manchester, firefighters found this woman unconscious on a sidewalk before she came to. They suspect she overdosed on opioids.
It seems like the opioid epidemic is sticking around.
New Hampshire is among the top 5 states for opioid-involved deaths. Its mortality rate is more than twice the national average.
New Hampshire has been particularly hard hit. And
Democratic candidates field questions about opioids at almost every stop.
And the time has come to recognize that addiction is a medical issue.
When these pharmaceutical executives know that they are pushing a drug that hurts people and they keep pushing it, they are personally responsible. They can be held criminally responsible.
Several have highlighted the issue at rehab facilities. Research shows the number of children across the country in foster care due to parental drug use has more than doubled in the past 20 years, something experts have linked in part to the opioid epidemic.
We're raising a nation of parentless children directly related to the opioid crisis. The biggest loss is that grandchild relationship. It's something to grieve over.
You've got to be the heavy.
I am the heavy. You know, I am. I'm the parent.
Devin swims and runs track. He likes hanging with athletes and says he's seen enough of addiction.
I don't know. I don't fear anything.
Nothing.
Not about my future at all. No, I'm not scared at all.
For more, let's bring in Dante Scala and Trent Spiner. Dante is a political science professor at the University of New Hampshire. Trent is a reporter for Politico covering New Hampshire politics. Dante, I want to start with you. We just saw how heartbreakingly devastating this opioid crisis has been in the state of New Hampshire. How big of an issue is this, opioids and drug-related deaths?
It's been consistently now for years the #1 issue that concerns locally the residents of New Hampshire, higher than education, higher than taxes, higher than anything.
Number one.
And it's striking, though, in terms of presidential campaigns. 4 years ago, when Hillary Clinton and Donald Trump were running, I think it was a shock, like nationally. It became a national story because it was being covered here with presidential candidates. Now, as your piece mentions, it's kind of become part of the routine that candidates will go to a treatment center because the problem has not gone away.
Really shocking sort of sign of the times. Trent, so Amy Klobuchar got very deeply personal when talking about her own family experience with addiction. This was last night at an event. Let's go ahead and listen to some of that.
One of the things about my life is resiliency. I didn't have a perfect life. A lot of people in this room didn't have a perfect life. But my dad's struggle with alcoholism taught me something even deeper than the need for treatment and the help that he got that I want to make sure that others get. It also taught me that you just can't see things in the extremes. I couldn't. I had to see in the middle. I had to see in the gray area because otherwise I couldn't love my dad because he was messing up a lot.
So, I wonder, Trent, you hear that, and she went on to talk about how not seeing the extremes is, in her view, an asset, and that if you want someone who's not going to just look at extremes, she's the candidate for you. Is that kind of approach likely to resonate here with New Hampshire voters?
It is, and I just want to go back to that video that you played with Major Garrett. They were showing video of a woman who was overdosing.
Yes.
And that was actually across the street from where I used to work. And so
really?
I know the exact spot, and it was always a problem there.
It's a very real thing.
It's a very real thing. That's a very popular, that was actually on the side of a very popular grocery store. So, I mean, this is an example of how it truly happens everywhere. That's how big of an issue it is.
Right. It's not just confined to one part of town.
No, right. And not just one type of not one group of people. It's really all socioeconomic groups in New Hampshire. To your question about Amy Klobuchar, this is something that she brings up every single stump speech.
Yeah, I'm going to actually, I think we're having some issues with your mic. Trent, we're going to try and fix that. But in the meantime, Dante, let me turn to you. You know, to Trent's point, how pervasive, you know, he brings up the fact that piece of video that was in Major's piece was just across the street from a place that he used to work. It's not confined to just one demographic, not just confined to one geographic area here in New Hampshire.
Certainly. It's a statewide problem which government is trying to address. I mean, certainly you see a lot of it in a city like Manchester, but the state has been grappling with ways to try to solve the problem. And it's striking with Klobuchar. You know, sometimes the final weekend before New Hampshire, candidates who have been working so hard kind of have this kind of like raw emotion bubbles to the surface when they're trying to connect with voters. We saw that with Hillary Clinton back in 2008 when she was talking about how difficult it was to run as a woman, and we see it now with kind of Amy Klobuchar. It's like everything kind of comes to a head that last weekend.
Right, a bit more reflection perhaps as they enter that final stretch. Dante, what are some of the other issues that you're going to be watching particularly closely tonight?
You know, I think we've seen health care and climate change be at the top of the issue agenda again and again in polls, not so much locally, but in terms of a national issue. And I think especially for younger voters, climate change is especially important. But what's lacking is foreign policy. 4 years ago, we were focused on terrorist attacks in Paris and California. This time around, despite conflict with Iran and so forth, that's definitely been a back burner issue for New Hampshire Democrats, voters as well as candidates.
Yeah, I wonder, Trent, I think we've got your mic fixed now. Is that what you've been hearing? You've been out talking to New Hampshire voters. What are they prioritizing in terms of issues?
You know, I was looking at your exit polls earlier that had the climate change is number 2 and healthcare is number 1. And I kind of see that as flip-flop when I'm out there talking to voters, and especially when they're taking questions on town halls. It seems like the number 1 question that people are asking is about climate change and what candidates are going to do about it, to the point where a lot of crowds are clapping or applauding when somebody asks that question, followed by healthcare. Candidates are really pushing the healthcare issue. They are they're asking people to introduce themselves who have gone through some really serious healthcare issues and maybe don't have insurance coverage to kind of tell their personal story. Finally, speaking of Iran, maybe I've heard in the last month 1 question about it.
Really? Even given what's happened in the news and the foreign policy front.
Right, yeah. I mean, it just doesn't seem to be popping for New Hampshire voters, at least.
Interesting. So, Dante, you have vast experience covering New Hampshire politics. Do the politics and issues here traditionally serve as a kind of litmus test for what we might see in the rest of the country here moving forward?
Occasionally an issue pops up here that we, you know, like the opioid crisis, that does resonate going forth. And New Hampshire Democrats are much more like national Democrats, at least, you know, certainly white Democrats. I think we will hear a different set of issues once we hit Nevada and South Carolina. But Iowa Democrats and New Hampshire Democrats have much more in common than, say, Iowa Republicans and New Hampshire Republicans.
Yeah. Trent, I want to ask you about turnout because, you know, there are all kinds of predictions about what we might see. What if turnout actually doesn't hit what the expectations are and they're actually below what we were expecting to see? What will that say about the electorate?
Right. So the New Hampshire Secretary of State thinks about 240, or maybe it was 290, right? Yeah. 290,000 people Democrats will vote, which is a decent, healthy number. Some of the things I'll be looking for is turnout in the college towns like Durham, where UNH is, Plymouth State, Keene, because I think that'll help Bernie Sanders and Andrew Yang, who you know, kind of are looking for that type of audience. And if turnout there is low, I think that'll be a challenge. I think if turnout is low in places like Manchester, where we are right now, or Nashua, where there is a lot of blue-collar workers, numbers. I think that could be a struggle for Joe Biden, though maybe he's got his own struggles at this point.
Yeah.
And then I'm looking at a couple of towns that voted for Barack Obama in 2008 and 2012 and then switched to President Trump. Towns like that have been a focus of Senator Klobuchar and Mayor Pete Buttigieg. And so I think if turnout is high in those areas, that could help them.
All right, a lot to watch. Dante Scala and Trent Spiner, thank you both very much.
Thank you.
Really appreciate it.